Thank you so much. So that moves us on to the next step, which is if we need testing or the patient already had a test before they come in. What exactly is nerve testing and how it's done, and what do you look for, Dr. Barr?
We use a machine, it's called an EMG machine, and we'll put little electrodes on the skin. So often we're going to be checking different fingers. And so there'll be ring electrodes, or there could be like sticky electrodes we're putting through the palm. And then we're going to give a very mild electric pulse through the nerve. And what we're doing with those stickies is we're picking up how fast the conduction is going through that carpal tunnel. And even though it's not a large amount of electricity, it's right over the nerve. So a lot of times we'll talk about it feeling like someone snapped a rubber band on your wrist. You know, it's an uncomfortable feeling, but typically not a super painful feeling. But if the nerve isn't really inflamed, it can be somewhat uncomfortable. And usually what we're doing is we're comparing how different nerves are conducting electricity in the hand. So we'll compare that carpal tunnel nerve, the median nerve, to your fourth finger with your ulnar nerve, and another nerve that doesn't go through the carpal tunnel. Then we'll compare the carpal tunnel nerve, the median nerve, with the radial nerve that doesn't go through your carpal tunnel. And in this way, we're sort of using you as your own normal control. So we're looking for slowing of the response through the carpal tunnel. And we're also looking at the size of response, because as the compression advances, the responses will get smaller.
Thank you so much.
And usually another thing that we're doing is we're ruling out other things it could be. So there might be like a second part of the test with a needle where we're making sure it's not a pinched nerve from your neck or something else common.
Excellent. Thank you.